If we go back to the reactive disease care approach, which is thinking about individual diseases in isolation, if you look at the major diseases that cause death and disability in the United States, they all have a single greatest risk factor. And that single greatest risk factor isn't what you eat. It's not whether you have high blood pressure. It's not whether you smoke. It's not how much alcohol you consume. It's how old you are, right? So aging is really the driver for every major disease, most major causes of death and disability in the United States. In fact, if you look at the top 10 causes of death in the United States, 9 of them have age as their greatest risk factor. The only one that doesn't is accidents, and under accidents is lumped opiates and other deaths due to addictive drugs. So age is really the driving factor for things that kill most people in the United States. It's also the driving factor for things that limit quality of life for most people in the United States. And if we can understand that biology that underlies the aging process, that gives us the opportunity to delay the onset and progression of all of these functional declines and diseases simultaneously. I believe that targeting the biology of aging is necessary for Medicine 4.0. It may not be sufficient, but it's necessary for Medicine 4.0. It's useful also to appreciate how necessary it is. So I've already said Medicine 2.0 focuses on individual diseases in isolation, and to the extent that Medicine 2.0 incorporates preventative approaches, they're all centered around risk factors that have effect sizes of, somewhere between 50% increase in risk and maybe 2 to 3-fold increase in risk. Things like alcohol consumption, smoking, obesity, super important, high blood pressure. In some cases, we know about genetic predispositions, like in the case of Alzheimer's disease, things like the ApoE gene, which can increase your risk. Again, all of those things increase risk somewhere between about 50% and at the high end, 4-fold increase in risk. Those are important. But if we compare that to the increase in risk that goes along with 4 decades of getting older, it's just dwarfed, right? At least an order of magnitude, in some cases, 2 orders of magnitude difference between 4 decades of biological aging and all of the other risk factors combined. So I'm not saying those other risk factors aren't important, but if you really want to focus on what's going to move the needle, modulating the biology of aging is going to move the needle way more than these other risk factors that we spend most of our time thinking about, to the extent that we think about risk factors at all and don't just wait until people are sick before we do anything, okay? So that's how Medicine 4.0 thinks about disease. Recognizes that biological aging is by far the most important thing we can modulate to keep people healthy, keep them from getting these diseases of aging for as long as possible. Medicine 4.0 is much, much, much more impactful than Medicine 2.0 in just about every way you look at it. But one way to look at it is by looking at life expectancy. And again, this is work that J.L. Shansky, who I've already mentioned in this episode, did a couple of decades ago now by asking a very simple question. What happens if we take the typical 50-year-old woman in the United States at that time and we cure cancer? So we look across the population, we get rid of all forms of cancer. For a typical 50-year-old woman in the United States, that gives about a 3-year increase in life expectancy. You can do the same exercise with heart disease. Just take it out of the equation. Get about 3 years increase in life expectancy. You cure both cancer and heart disease, the 2 leading causes of death in the United States for the last 50 years. Get rid of them. Typical 50-year-old woman gets about 7 years of added life expectancy. So that's not insignificant, but it's probably not as big as most people would assume. And especially when you consider the vast majority of resources that goes to biomedical research has been aimed squarely at the war on cancer or curing heart disease, right? In isolation. And I think we can have an honest debate about how effective those resources have been at accomplishing those goals. Certainly there have been strides, but we haven't cured either one of those things. In fact, the 2 leading causes of death in the United States 50 years ago were heart disease and cancer. The 2 leading causes of death today are heart disease and cancer. Okay, so it's really, really hard to cure disease at the population level. Now, if we compare that to the effect of slowing aging, and this is routine in laboratory animals. I'm not going to pretend we can do this in people today or that we can prove we can do this in people today, but let's just say that we could, that the biology of aging is conserved enough that we can target aging in people effectively. You get a much larger increase in life expectancy, maybe as much as 2 to 3 decades, with the added value that those years are spent in relatively good health, free from chronic disease and disability. This is hypothetical, right? I'm not suggesting we can do this today. In fact, I would suggest we can't do this today. But I do think it's possible for us to do this, and maybe in the not too distant future.